Greetings, friends and neighbors, and welcome to episode 15 of the Community Solutions Podcast, coming to you from all of us at the Department of Social and Behavioral Sciences at the Indiana University Fairbanks School of Public Health in chilly downtown Indianapolis, Indiana. I'm Jack Turman Jr., a faculty member in the department, and your host for this podcast. We are glad to be back. Some technical issues and travel schedules caused us to miss a few weeks, but we are back for the next few weeks, and then we will be taking a holiday break to prepare for the launch of some cool new episodes to kick off 2019. Thanks for sharing our podcast with all your friends and neighbors. We're so grateful. Since starting the podcast at the end of June, our Community Solutions neighborhood has grown to include listeners in 29 states and the District of Columbia, and to 13 other countries. Let's keep nurturing healthy, hope-filled neighborhoods around the globe. Today, Mariana Lopez Owens and Kristen Starkey, project managers in our department, converse with Dr. Gerardo Mapalme, the Associate Dean for Research in our School of Public Health. Gerardo is a staunch supporter for working with community members in public health research programs, and he has done this with great success as he works to promote oral health in immigrant communities. Through the conversation, you will learn about the different ways of including community members in community-based research efforts, and how he has done this through Vida Sana, his community-based oral health promotion project for Latinos. I hope you enjoy this conversation and can apply some of its wisdom as you work to be inclusive of all immigrants in your community. Take care, and let's join the conversation.
Hi, I'm Mariana.
I'm Kristen.
I'm Gerardo.
So let's start out with these questions. So Dr. Mapalme, why do you think involving the community in research is so important?
When you are trying to solve public health problems, it is absolutely essential that the questions and the solutions are relevant to the community. So if you start from an ivory tower and do not spend time figuring out what are the local social norms, what matters to people, you're running the risk of creating knowledge that it is not terribly relevant to really address problems. That's why instead of assuming that we know everything about the community, and this is not detrimental to doing good quality formative research, it is also important to make sure that the community has an opportunity to see what is it that we're planning to do and collaborates at different stages. Now, community engagement is just one way of saying that we want to work with the community, not on the community. Perhaps most importantly is because of the research question you have in mind. You need to decide what kind of involvement the community is going to be playing in the research you're doing. For example, the highest level of involvement, community-based participatory research, you have community members being part of the operation from the get-go, from the beginning of design, posing questions, deciding what to do, what is a meaningful outcome, how are you going to measure things, and so on and so forth. With community-engaged research, you have a slightly lower level of involvement, but still it is important to make sure that you're doing things in the eyes of the community as being relevant, being important, and most of all, really the issue is that you are addressing a real problem with a real solution.
So, how do you ensure that the issues that we're solving matter to the community, and how do you go about selecting your community partners?
I think the most important aspect here is that the selection of community partners really has to grow organically from your contact with the community. It will be really hard to think that you can do community engaged research without having prior knowledge of the community. So the most important thing to keep in mind is that partnership has to grow organically by making sure that you present yourself as a person that is useful to the community and brings ideas and solutions and proposals that are perceived to be important, relevant, and most of all that they are feasible to be adapted to real life. Now, there is also the issue that whomever is working with community partners needs to have some prior knowledge of that. And I think that the Vida Sana study that we are running in Indianapolis and other parts of Indiana is a prime example of that, because most of our staff is bilingual. The vast majority of our staff belongs to the group that is going to be our most important partners in the community and the solutions that we are trying to figure out. But the other part that is very important is that we know very well, we have an intimate knowledge of how the community have transactions in terms of daily life, finding health solutions, identifying problems, what has been tested and doesn't work, what is the preferred value of some of the interventions, and so on and so forth.
So I know that you work with Latinos in a lot of the work that you do with the community and your research. So what have you found with your research, and then what you've heard from the community? What is the biggest lack of resource for Latinos?
I think that we have really a dual scenario here, because on the one hand you have Hispanics that have been living in Indiana for some length of time. They have adapted. They have most likely some sort of documented status in the country and in Indiana. And then you have another group that are the newcomers, those that more often than not will perhaps have an undocumented status. And this is where the range of options to address health problems becomes a lot more limited. And whether we like it or not, we live in an age where these things are rather important. And lack of resources is a major issue, because if you don't have access to basic government-funded programs, then the range of options to address health problems is diminished. I can tell you that, for example, in other research efforts that we have done in the past, it is quite common to find that immigrants, not only Latinos, but from other communities, will go back to their home country, visiting family, let's say once a year or every couple of years, and they will actually solve a lot of those healthcare issues back at home, because they know the system better. Perhaps the range of prices will allow them to be able to afford more comprehensive treatments and that kind of considerations. But the problem right now is that that kind of opportunity for some of the immigrant communities is very limited, and that is simply because their ability to go to their home country is very limited. So we have all sorts of complicating factors that speak to how health problems are far more complex than simply saying, well, you knock at the door of a hospital or a clinic and then you get the care you need. It is actually a lot more problematic. It depends on what is perceived to be feasible, what is perceived to be affordable, what can be purchased in actual fact, and what kind of medical or dental insurance is available to that person in particular. So we have a lot of complicating factors that intermix with the social, clinical, and epidemiological factors that we detect in communities that originate from outside the United States.
All right. So, what is the Vida Sana study, and how does it relate to everything you just talked about?
The Vida Sana study is a large-scale study that is funded by the National Institutes of Health. The idea we have is, in order to better understand the social norms and the kind of solutions that people implement in response to perceived and actual health problems, they need to understand how they're going to address what is the immediate and the long-term kind of situation. One of the problems with immigrants, regardless of whether they are recent or long-standing immigrants, is that their ability to use resources in the community is not as optimal as you will expect from other communities. What the Vida Sana is trying to do is to better understand how the evolution of the social groups for these people will allow them to implement better or worse solutions to health problems. The notion goes like this. Because we hang together with people we feel that we are like. For example, I hang around with friends who like to watch football on Sunday, and we have a couple of beers. And if I were to hang around with other people who are more interested in doing some cycling and going out rambling in the woods, my health outcomes will be different from those that are more of an active lifestyle. But we tend to get together with people that we share values with and we have similar social norms. And this is what the Vida Sana study is trying to address. The main important aspect is that if we look at how people share these values, these pieces of knowledge, these ideas about health, we can figure out what are the most efficient ways of improving outcomes, either to diminish the importance or the impact of bad behaviors, or to enhance what good behaviors could be in place that help people have better health outcomes.
Okay. And for our final question, for the people listening out there, what are 5 things that our listeners can do to promote oral health in their communities?
Promoting oral health is not simple. And on the simplest perspective, making sure that you brush your teeth at least twice a day with a fluoride-based toothpaste is a good basis for health. A professional recommendation is also to floss regularly. But at the end of the day, what we really find when it comes to the community level is that there is a major problem for those communities that rely too much on high-calorie food that are very rich in simple sugars. And the reality of the matter is that Western type of diet tends to have a lot of sugar in it. And some of it is hidden, for example, in ketchup or in canned soup. In reality, simple sugars are a very important part of industrialized food because it increases the flavor, makes the texture simpler, extends a shelf life. In food industry, sugar is very important. It has the nasty sequel of promoting the growth of bacteria in the mouth. What happens with sugar in the mouth is that bacteria that will normally live there tend to find a more and more receptive environment if they have more sugar to feed off with. So what happens is that bacteria that will otherwise just be in the mouth and in small amounts will not cause tooth decay. You will find that what you have is that if you start putting a lot of sugar, there will be a lot of acids that are a byproduct of the bacterial metabolism. So bacteria eat sugar and they release acid. That acid, if it is too prolonged an insult on teeth, it will start undermining the surface of the tooth and eventually it leads to a cavity. Once that it has a cavity, then you will need to see a dentist to have that fixed. The problem is that most of these situations are not really fixing the problem because the disease is the ecological environment of the mouth. It's not so much that you have a hole on your tooth. That is just a manifestation of a long-standing noxious environment that is really not all the best for your mouth. So that's as far as sugar and tooth decay is concerned. Another thing that is important, and I would like to emphasize that, is that gum health, periodontal health, is governed by several factors. But one factor that still remains very important is the use of tobacco, because tobacco use, either chewed or smoked, is one of the most important determinants for poor periodontal health. So it is absolutely important that those people that think that tobacco use is not really for them make this leap also thinking that tobacco cessation is a good idea simply because to keep on smoking is going to also affect not only lungs and the likelihood of having cancer, but also because of periodontal disease and problems that will be very hard to solve unless you get into very expensive dental treatment with a dentist. And thank you so much for the invitation. It's very kind of us.